It is now my pleasure to turn today's program over to Charles Gluck. The floor is yours.
Thank you very much, Janine. Welcome, everyone, to Understanding CPC Plus and the Quality Payment Program in 2017. During this event, we are going to take any questions you have regarding the Quality Payment Program. We really want this to be helpful for you. Please take advantage of using the Q&A pod that's on the left side of your screen, or you can also ask over the phone, and the phone numbers are listed on the screen there, and just press *1 to put yourself in the queue to ask a question. And with that option, please provide your name when you're prompted, and you'll hear your question. If you hear your question asked and you want to get out of the queue, you can just press the # key, and that will take you out. So we'll be taking questions later in the program, but at this time, the Center for Medicare and Medicaid Services would like to welcome you. Ben, I turn the program over to you.
Great. Thank you so much, Charles, and thanks everyone for joining us this afternoon or morning, depending on where you're calling in from. We created this webinar in response to a lot of feedback from our CPC Plus participants who wanted a little bit more clarity on how CPC Plus fits into the broader quality payment program. And so we're very lucky today to have Patrice Holtz and Ben Shin, as well as some other experts from around CMS, including the Shared Savings Program and others, with us today to answer all of your questions. As you heard, we will be taking questions at the end, so please go ahead and type those in or call in at the end of the webinar. But hopefully throughout the presentation, we'll be able to answer some of those questions that are top of mind for you. So with that, I'd like to pass it over to Ben.
Thanks, Ben. And before we get into the details of the Quality Payment Program, specifically for CPC Plus practices, we'd like to provide a brief overview of the Quality Payment Program. And you can advance to the next slide. Now, we won't spend too much time giving an overview of the program, but we do want to start by reviewing the two parts of the Quality Payment Program and the different types of alternative payment models. I'd like to mention also, for a more detailed overview, for fact sheets and other educational materials about the Quality Payment Program, please visit qpp.cms.gov. Next slide. To get started, the Quality Payment Program is made up of two parts, or rather two tracks: the merit-based incentive payment system and advanced alternative payment models. Clinicians can choose how they want to participate in the Quality Payment Program based on their practice size, specialty, location, or patient population. If clinicians decide to participate in traditional Medicare, they may earn a performance-based payment adjustment through MIPS. Clinicians may also be excluded from MIPS if they are clinicians who enroll in Medicare for the first time during a performance period, if they are clinicians who have Medicare Part B allowed charges of less than or equal to $30,000 a year, or if they see 100 or fewer Medicare Part B patients in a given year. And lastly, if clinicians are significantly participating in advanced APMs. The second track of the Quality Payment Program is the Advanced Alternative Payment Model track. If clinicians decide to join an advanced APM, they may earn a Medicare incentive payment for participating in advanced alternative payment model. This is a 5% incentive payment or bonus that is available to qualifying APM participants, or QPs, which we'll review in detail later in the presentation. Next slide. Moving on to alternative payment models. Generally speaking, an APM is a payment approach that provides added incentives to clinicians to provide high quality and cost-efficient care. APMs can apply to a specific clinical condition, a care episode, or a population. In the Quality Payment Program, we have two additional types or subsets of APMs. We have MIPS APMs, which are APMs that benefit from the special APM scoring standard by aggregating APM-related performance data to streamline reporting to MIPS. Eligible clinicians and MIPS-eligible clinicians can participate. We also have advanced APMs, which are APMs that have met the three criteria to be considered an advanced APM. Briefly, the three criteria are that an APM requires participants to use certified EHR technology. The APM provides payment for covered professional services based on quality measures comparable to those used in MIPS. And third, it requires participants to bear more than a nominal amount of financial risk. It's important to note here that an APM can be both a MIPS APM and an advanced APM, and in fact, CPC Plus is both. Next slide. So over the next few slides, we will get into the details of the quality payment program for standard CPC Plus practices. To clarify, by standard we mean CPC Plus practices not participating in an ACO. Next slide.
Great. So before we get into some of the details of the quality payment program for standard CPC Plus practices, I want to start by making sure we're very clear about our definition of a CPC Plus practice. So here at CMS, we consider your CPC practice, I think we're on the wrong slide. Could we go back, please, to slide 9? Thank you. So at CMS, we consider your practice as designated by your CPC Plus practice ID number to be the list of NPIs on your practitioner roster in the CPC Plus practice portal. So that's straightforward enough for a lot of our independent primary care practices. But what that means for you if you're in a multi-specialty practice or if you're owned by a health system or some other sort of parent or owner organization, is that you should view your CPC Plus NPIs as a distinct entity within your larger organization. So for the rest of this presentation, when we refer to your CPC Plus practice, we mean that specific group of NPIs, not the whole medical group or health system. It's this group just of CPC Plus practitioners who are in the alternative payment model. Next slide, please.
So how do eligible clinicians in CPC Plus become QPs? Well, over the course of the QP performance period, CMS will calculate a percentage threshold score for each CPC Plus practice for each of the 3 snapshot periods, which we will explain in more detail later in the presentation. To do this, CMS will use 2 methods, the payment amount method and the patient count method, and use the more favorable of the 2 results in making QP determinations. For each threshold score calculation, CMS will calculate the numerator as the payments for Part B professional services furnished to attributed beneficiaries of a given CPC Plus practice, or the number of attributed beneficiaries to a given CPC Plus practice who are provided a Part B professional service. The denominator will be calculated as the payments for Part B professional services furnished to attribution-eligible beneficiaries of a given CPC Plus practice, or the number of attribution-eligible beneficiaries provided a Part B professional service. And to clarify a bit more, attributed beneficiaries are a subset of attribution-eligible beneficiaries, which represent the population of beneficiaries that could be attributed to an APM. Next slide. So how are MIPS APM clinicians and advanced APM QPs paid? For MIPS clinicians participating in CPC Plus practices that are not exempt from reporting to MIPS, they will benefit from the APM scoring standard through their participation in CPC Plus or their Medicare Shared Savings Program, which are MIPS APMs. The MIPS payment adjustment is based on the data reported, and the best way to get the maximum MIPS payment adjustment is to participate for a full year. Based on performance in 2017, clinicians will see a positive, neutral, or negative adjustment up to 4% on their Medicare payments for covered professional services furnished in 2019. For eligible clinicians in CPC Plus practices that become QPs, for payment years 2019 through 2024, clinicians who reach QP status are excluded from MIPS adjustments and receive a 5% lump sum incentive payment for their Part B professional services furnished during the calendar year immediately prior to the payment year. And this is for payment years 2019 through 2024. Next slide. And I'll turn it over to Patrice.
Thanks, Ben. The next slide shows how the MIPS eligible clinicians are scored in CPC Plus. This scoring pertains to a CPC Plus practice that is not a participant in the Shared Savings Program. For a CPC Plus eligible clinician to be included in the MIPS APM and receive a scoring under the APM scoring standard shown below, the CPC Plus eligible clinician must appear on the CPC Plus participant roster on at least one of the participant list snapshot dates. These dates are March 31st, June 30th, or August 31st. So they must be on the list on one of those dates. All scoring will be calculated at the APM entity level, and the APM entity in this case is the CPC Plus practice. Each MIPS eligible clinician in the CPC Plus practice will get the same score, which is the CPC Plus practice score or the APM entity score. As you can see, CPC Plus MIPS eligible clinicians are not scored on the quality or cost MIPS performance categories for the 2017 performance period, which is the period that we are in right now and is considered the first year of the MIPS program. For the improvement activities category, the CPC Plus MIPS eligible clinicians will automatically receive full points for this category. This means that you as a participant do not have to do anything for this category. We have automatically calculated into your score the full amount of IA points that you can get. Therefore, the only category you are required to report is the Advancing Care Information MIPS Performance category for 2017. In this category, MIPS, you report to MIPS as either an individual or part of a group TIN. CMS will take the highest score for each CPC Plus MIPS eligible clinician and then average those scores to yield a single group score, which will actually be your CPC Plus practice score, or in other terms, the APM entity score. That score, added together with the IA score, will be your total composite score for the 2017 performance period. Next slide. Over the next few slides, we will get into the details of the QPP for dual participants in CPC Plus and the Medicare Shared Savings Program. Next slide. Okay, so dual participation in CPC Plus and a Shared Savings Program ACO. This slide shows that when a CPC Plus practice is participating in an SSP ACO for the 2017 performance year, the APM entity is considered to be the ACO and not the CPC Plus practice. This is very important because the scoring and reporting requirements are a little different when the APM entity is the Shared Savings Program ACO. As you can see, if you're a dual participant, and again, a dual participant means you are participating in a CPC Plus practice in a Shared Savings Program ACO, and you're in track 1, you are not considered to be in an advanced APM, and therefore you're also not eligible to become a qualifying participant. But if you are on the Shared Savings Program participant list on one of the 3 previously mentioned dates, then you will be included in the MIPS APM scoring for the Shared Savings Program. And we'll go through these reporting and scoring requirements on the next slide. For CPC Plus practices that are also participating in the Shared Savings Program ACO tracks 2 or 3, the ACO is the APM entity, and the participants are eligible to become qualifying participants because SSP tracks 2 and 3 are considered to be advanced APM. If the ACO clinicians do not collectively meet the QP or the qualifying participant threshold, then the participating eligible clinicians will be scored under the APM scoring standard as a MIPS APM. CMS will use the Shared Savings Program participant list to determine which eligible clinicians, including the CPC Plus eligible clinicians, are on the shared savings program participant list on at least one of those 3 snapshot dates, which again are March 31st, June 30th, and August 31st, to be scored as a MIPS APM under the reporting and scoring requirements for the shared savings program ACOs. Next slide. How are MIPS eligible clinicians scored in the Medicare Shared Savings Program? And this applies for all tracks, tracks 1, 2, and 3 of the Shared Savings Program. They are scored on quality at 50%. The ACO will submit the measures to the CMS web interface on their behalf. And if the ACO does not submit measures on their behalf, all scoring for this MIPS APM will revert to participant TIN scoring. So it's the ACO participant TIN that would score. This happens rarely, so in most cases, the ACO is going to submit measures to the CMS web interface and be scored as they normally are under shared savings program requirements. For the cost category, you will not be scored or assessed on cost. For the improvement activities, this is exactly the same as it is for a CPC Plus standard practice. There's no additional reporting required. CMS has already assigned the shared savings program, all tracks, a total possible score for this category, which is 40 points. Therefore, there's nothing that you need to do. This category is weighted at 20%. And last, the advancing care information category, all ACO participant TINs in the ACO submit under this category according to the MIPS group reporting requirements. This is done for all tracks, and I repeat that. The Shared Savings Program has a requirement that ACI be reported as part of the Shared Savings Program requirements. So whether you're a QP or not, whether you're an advanced APM or not, it doesn't matter. For the advancing care information category, you are going to report the ACI as a ACO participant TIN according to all applicable requirements of the MIPS program. Next slide. Ben, I'll turn it over to you.
Thanks, Patrice. And over the next 2 slides, we'll get into the details of the timing for assessment and payment in the Quality Payment Program. Next slide. So how and when does CMS identify clinicians participating in MIPS APMs or advanced APMs? As mentioned earlier, CMS will use 3 different snapshot dates to identify whether a clinician is participating in an advanced APM or a MIPS APM. An eligible clinician must be on a participation list, or in the case of CPC Plus in the Medicare Shared Savings Program, a practitioner roster or ACO participant list on at least one of the 3 snapshot dates for the QP performance period. CMS will also use these snapshot dates to make QP determinations for advanced APM participants. What that means is CMS will calculate QP threshold scores for performance from January 1st through each of the 3 snapshot dates. If an APM entity group collectively meets or exceeds the QP threshold from their performance through any of these snapshot dates, all eligible clinicians in that APM entity group will be QPs for the performance year. Next slide. The QP performance period is a period during which CMS will assess eligible clinicians' participation in advanced APMs to determine if they will be qualifying APM participants for the payment year. The QP performance period will be from January 1st through August 31st of the year, that is 2 years prior to the payment year. For example, the first QP performance period will be from January 1st, 2017 through August 31st, 2017 for the 2019 payment year. Those eligible clinicians that become QPs receive a 5% lump sum incentive payment calculated from their Part B professional services furnished during the calendar year immediately following the performance year and immediately prior to the payment year. Next slide. So how and when are QPs determined and notified? As mentioned earlier, CMS will use the 3 snapshot dates to make QP determinations for advanced APM participants. And as shown by the timeline on the bottom of the slide, for each of the 3 snapshots in the QP performance period, CMS will use claims data from period A for the clinicians captured in the snapshot at point B. CMS then allows for claims run out during period C and finalizes QP determinations at the earliest, point D. Importantly, though, if a CPC Plus practice or ACO meets the QP threshold through one snapshot date, eligible clinicians added to the participation list do not automatically confer QP status. If the group meets the QP threshold for a subsequent QP determination, then the newly added eligible clinicians become QPs. Next slide. Over the next few slides, we will provide a summary of CPC Plus and the Quality Payment Program for 2017, including different reporting scenarios. Next slide. So this slide provides an overview of reporting requirements in CPC Plus. Now, as you can see, we've outlined the different ways a CPC Plus practice can participate in CPC Plus and the Medicare Shared Savings Program. Moving left to right, starting with practices participating in CPC Plus only, you're participating in both an advanced APM and a MIPS APM and will be exempt from a MIPS payment adjustment if QP status is reached. If not, each clinician in the practice must report advancing care information, or ACI, individually or as part of a group. Moving on to the middle boxes, for practices participating in CPC Plus and SSP Track 1, you are participating in only MIPS APM and thus not eligible for QP status. Therefore, each ACO participant TIN must report ACI at the ACO participant TIN level and will be subject to a MIPS payment adjustment. Moving on to the last set of boxes, for practices participating in CPC Plus and SSP Track 2 or 3, you are participating in both an advanced APM and a MIPS APM and will be exempt from a MIPS payment adjustment if QP status is reached. To note, even if QP status is reached, each ACO participant TIN must report ACI at the ACO participant TIN level. If QP status is not reached, again, each ACO participant TIN must report ACI at the ACO participant TIN level and will be subject to a MIPS payment adjustment. Next slide.
Okay, so this slide shows what the reporting requirements are for a standard CPC Plus practice that is not participating in the Shared Savings Program. The first step is to determine if the CPC Plus eligible clinicians are on the CPC Plus practitioner roster on any of the 3 snapshot dates. If the answer to that question is no, then the CPC Plus practitioner should report to the MIPS program for the 2017 performance period as an individual or as part of a group under all applicable MIPS reporting and scoring requirements. If the answer to whether they're on the roster is yes, the next question we ask is, did the CPC Plus practitioners collectively hit the minimum qualifying participant threshold score for 2017? If the answer to that is no, they become scored under the MIPS APM under the APM scoring standard, and as we previously showed on slide 12, we showed the categories that they are reporting, how they're reporting, and the weights for those categories. If they meet the QP threshold, then they are exempt from MIPS. Just as a note, on all of the information we provided so far, this is an overview of the Quality Payment Program reporting requirements. The CPC Plus practices must report according to all CPC requirements, and that includes CPC Plus practices that are dual participants of the Shared Savings Program. So they must also meet the requirements of the Shared Savings Program. Next slide.
So I'd like to build off what Patrice just said about fulfilling all the requirements of the Shared Savings Program. The same goes for CPC Plus. So any practices in CPC Plus, Track 1 or Track 2, are still bound to the requirements for quality reporting, for example. What we've been presenting in this presentation are specifically the requirements under the Quality Payment Program. And we've also been referring to CPC as the CPC practice, both Track 1 and Track 2. When we've been talking about Tracks 1 versus 2 and 3, that's all been the Shared Savings Program. But for the purposes of this presentation and for the Quality Payment Program, Track 1 and Track 2 in CPC Plus, they are treated the same. We had a number of questions about how reporting works under the Quality Payment Program if you're a CPC Plus practice in a larger organization. And I'm talking about an owner organization like a health system or a medical group, not a Shared Savings Program ACO in this case. But as I said at the beginning of the presentation, in this case, you should consider the list of NPIs on your CPC Plus practitioner roster to be a distinct entity. Any other NPIs who share your TIN, whether they are in a multi-specialty practice with you or they're in other practices within a health system, they're not affected by your participation in CPC Plus or the CPC Plus clinicians' participation in CPC Plus for the purposes of the Quality Payment Program. So unless they are participants in another APM, these clinicians are responsible for reporting to MIPS as usual. They're not eligible to become QPs or receive the special APM scoring standard just because you are in CPC Plus or one of your other clinicians is in CPC Plus. But as we said earlier, the rules are a little bit different if you are also in a Shared Savings Program ACO. Next slide, please.
So for the next slide, we wanted to point out a common occurrence in the current CPC Plus program. We have a large number of CPC practices that are dual participants of Track 1 ACOs. And in this case, this is exactly what the reporting requirements will be. You are considered part of the ACO. The ACO is going to have CPC Plus participants, TINs, and eligible clinicians, and they're going to have other ACO clinicians. The first step is asking whether you are on the Shared Savings Program participant list on any of the 3 snapshot dates. If you are not on the Shared Savings Program participant list on any of those 3 dates, you only need to be on one, then you should elect to report to MIPS either as an individual or as a group TIN, and you're reporting according to all MIPS normal reporting and scoring requirements. If you are on a participant list, you are definitely going to be included on the APM scoring standard under the MIPS APM of the Shared Savings Program. And under slide 15, we reviewed the scoring requirements, the weights for the categories, and what specifically you would be required to report. Again, ACI is required for all categories, all tracks of the Shared Savings Program, and that's so that they can use that for the APM requirement for Measure 11, which is the Certified EHR Technology Measure. Next slide.
And so finally, reporting as a dual participant in CPC Plus and a Track 2 or 3 Shared Savings Program ACO is similar to reporting as a dual participant in Track 1, except you may reach QP status and be exempt from MIPS. If you were captured on the ACO participant list for one of the 3 snapshot dates, then you will be either become a QP through your participation in your Track 2 or 3 ACO, or you will need to report to MIPS as part of your Track 2 or 3 ACO by way of the MIPS APM scoring standard, as we mentioned earlier. And with that, I'll turn it back over to Ben. Next slide.
Fantastic. Thanks so much. Joining us today to answer your questions are, of course, me, Ben, and Patrice. And as I said at the beginning of the presentation, we have some special guests who are experts from around CMS who can answer some of your more specific questions as they relate to the Shared Savings Program or other components of the Quality Payment Program. As Charles mentioned at the start, there are 2 ways to submit your questions. You can use the Q&A pod located on the left side of your screen, or you can ask over the phone. If you want to do that, just join the session using the audio options listed on the screen and press star 1 to be placed into that queue. With that option, if you choose it, please provide your name when prompted, and you'll hear your question asked and answered. While you're waiting, you can always remove yourself from the queue by pressing the pound key. So let's get started with some of those questions. First off, I've seen a couple questions about how clinicians are going to be notified that they are a QP. Ben, do you have a response on that?
Yes. So as we showed on slide, I believe it was slide 19, clinicians will be notified at the earliest in essentially 4 months after the end of the snapshot period, from when the snapshot period is, the snapshot date. Clinicians will be notified through the QPP portal, and they'll be able to log on, enter their MPI information, and see if they are a QP.
Great. Thanks, Ben. I've seen a couple people wondering if there's a limit on the number of eligible clinicians in your practice when it comes to being determined whether or not you're a QP, if there are size requirements.
The answer to that question is no size requirements.
Great, thanks. I have a question. Will ACO EPs be able to attest individually and get their scores rolled up at the ACO TIN level, or will the ACO have to report their scores as a group?
This is Terry Postma with the Shared Savings Program. For ECs that are participating in the ACOs, regardless of track, it's very, very simple. They just have to worry about reporting ACI data in the way that MIPS allows them. And as Patrice noted, we strongly encourage each ACO participant TIN to report as a group because we feel that that will reduce burden for all the ECs in the group. Once your group, if you're subject to MIPS, your group score on ACI is going to be weighted according to the ECs that are in it. It'll be aggregated with the weighted scores of each of the ACO participant TINs that are participating in the ACO, and that will generate an ACO entity group level score for that category. That will then be combined with the other 3 categories under MIPS to generate a final MIPS APM score that will then be applied to all the ECs that are participating in the ACO. Of course, if you're a QP that's participating in an ACO, you're not going to get that score and not be adjusted under MIPS. You'll just get the 5% bonus for being in an advanced APM. But as Patrice said, really it doesn't matter what track as an EC you're participating in, your group, ACO participant TIN group should report under ACI. And the reason for that is because, as Patrice said, under the Shared Savings Program, there's a quality measure of the level of certified EHR technology use that's calculated for the ACO for the shared savings program, and it's double weighted, so it's really important that that you as an EC participating in the ACO report that data to CMS.
Great, thanks so much, Terry. Here's another question. Someone says, I've seen some information that if one eligible clinician completes an improvement activity, it counts for all within a TIN. In the example on slide 23, will some participants being in CPC Plus count as the improvement activity for all providers in the TIN, or do the non-CPC Plus providers need to do improvement activities? Who's best to answer that?
Also from the Shared Savings Program, the CPC Plus folks will answer that for CPC Plus only participants. But for participants that are in CPC Plus and also in the Shared Savings Program ACO, there's no reporting required for you for improvement activities. And under this category, CMS has determined that your participation in the ACO meets all requirements for full points on that category. So you're going to get full points. No additional reporting is required.
Thanks, Terry. And that is exactly the same for the CPC Plus participants. So everyone on the phone today listening, you do nothing for the improvement activities category under MIPS. You've already received, CMS has assigned you the total points that you can get for this category because you're already doing many of these improvement activities under the requirements in participating in your respective APM.
Thanks, Patrice. I've seen a couple questions coming in about the definitions of beneficiaries and eligible beneficiaries when it comes to the QP threshold. And also another question or two related to that about whether practitioners who are in a multi-specialty practice will have the specialists included in the denominator if they're participating in CPC Plus. So whether that's just the CPC Plus clinicians who will be looked at for QP determination, or if it will be the specialists as well. Ben, could you go over the numerator, denominator, and eligible for attribution question?
So for the numerator, the only beneficiaries that would be included are beneficiaries that have been attributed to the APM entity through the advanced alternative payment model. The attribution eligible construct is really to ensure that the denominator of the QP threshold calculation only includes patients and associated payments who could potentially be attributed to an advanced APM entity and thus could also appear in the numerator of the QP threshold calculations. And that will be determined on those ECs who are participating in the advanced APM entity and no other ECs.
We also had some questions about where to find out more information on the QPP program. You can go to qpp.cms.gov, or you can call 1-866-288-8292, or you can email qpp@cms.hhs.gov. There's a lot of, and if you're interested, by the way, in reviewing the improvement activities that CMS has included for your 40 points for the improvement activity score under MIPS, there's a document that's on the QP website that does show those. The CPC practice that is not part of the shared savings program receives those points because they are considered a medical home model, and as a medical home model, you receive the full points for the improvement activities.
We've had some questions about the snapshot dates. One of those questions is, we are a Track 3 ACO and are hoping to obtain advanced APM status. Assuming we obtain advanced APM status, do we need to submit MIPS data separately for providers who are not on the provider list by the third snapshot date, or are new providers covered by the advanced APM status of the rest of the ACO TIN?
So I think there's two questions there. One is advanced APM status, and one is, if you're in advanced APM, are you a qualifying participant? The first, for a Track 3 shared savings program, is you are in an advanced APM. That's already been decided. The next question is whether you have met the threshold to become a qualifying participant, and you, as a result of meeting that threshold, you will be receiving the 5% APM bonus.
And I just want to add that any clinicians will need to be captured on the snapshot dates in which that QP determination is made to receive the 5% incentive payment bonus. So they are not on the ACO participant list either March 31st, June 30th, or August 31st. They will not be QPs.
And this is Terry Postma from the Shared Savings Program. I just want to add to what Ben and Patrice said, which, and earlier in the presentation when they were talking about the snapshot dates. To determine QP status, they're going to take the ACO participant TIN list from the Shared Savings Program that your ACO certified at the beginning of the performance year. They're going to use that ACO participant TIN list to determine what ECs are participating or billing through those TINs at those given snapshot dates. That composition can change throughout the course of the year. So the first snapshot, which is March 31st, they're going to use the ACO participant list to determine what ECs are currently billing through the TINs of those ACO participants. They're going to be determining the QP status of those ECs at that time at the ACO level, so as a group as a whole. And if QP status, if that threshold has been met, then all the ECs that are participating at that time get QP status for the performance year. They're going to perform that snapshot again 3 months later. Now, in the meantime, you might have had clinicians that have joined a billing TIN that's participating in the ACO or have left the TIN and are no longer billing through that ACO participant TIN. So the ones that have left have gotten QP status as of the first snapshot date. They're going to keep that QP status for the performance year. The ones that have joined, the QP determination is going to be made again at that second snapshot date, and if the threshold is met, then they will get QP status for the performance year. If the threshold is not met at that subsequent snapshot date, then the QP status that was conferred to the ones that are still participating, they'll still keep their QP status. The guys that join new that caused the threshold to drop will not get QP status. They'll be assessed under the MIPS APM standard instead. So I hope that's clear. Yeah.
Absolutely. And while we're on the subject of the Shared Savings Program, and the microphone is next to Terry, I wanted to go to this question. How is CMS identifying SSP or Shared Savings Program participants? Is it via an ACO-provided list of NPIs, or is it based on the providers who bill Medicare charges under a participant TIN? And then they ask, what if a provider is in SSP and does not bill Medicare? Will they be counted on the participant list?
It's a great question, and I can answer the first one. For purposes of the Shared Savings Program, we use an ACO participant TIN list, and although we collect NPIs as part of our ACO provider supplier list, that is not the list that QPP is going to be using. They're going to be using the ACO participant TIN list. And the reason for that is because under the Shared Savings Program rules, TIN cannot be on that list unless all the providers and suppliers that bill through that TIN have agreed to participate in the ACO. So the QPP is going to take and use the ACO participant TIN list throughout the course of the year. And maybe others can answer the other question. If they had no billings under the TIN, are they still included?
If they had no billings and they're on the ACO participant TIN list, they would still be included.
We will look to PAYGO 3 assignment data. This is Carrie Vandergrift. So we'll include that with the claims information as well.
Thanks, Carrie.
There's one question, is the 5% bonus in addition to the PBIP? So the answer is essentially yes. If you're just in CPC Plus, the performance-based incentive payment is just for the CPC Plus program, and it's one of the specific CPC Plus payments. And the 5% bonus comes if your CPC practice is an advanced APM because you have met the QP threshold, and that's through the quality payment program more broadly.
We do want to add, though, if you are a dual participant in both CPC and the shared savings program, you are not going to receive the performance-based payment from CPC. Instead, you are eligible for the shared savings payment from the shared savings program.
And that leads nicely into this next question. If we're a CPC Plus Track 2 practice only and we have QP status, I understand that we are exempt from a MIPS negative adjustment, but are we still required to report ACI?
If you have met QP status, you are still required to report ACI. ACI here is a program requirement of the shared savings program, and it meets CMS, the Shared Savings Program 11 Certified EHR Technology Measure requirements. That data from the Advancing Care Information category is fulfilling the requirements of that ACO 11 measure.
If you are not in an ACO in the Shared Savings Program and you're only in CPC Plus, if you reach the QP threshold and you are an advanced APM, you do not need to report ACI because you are already meeting the health IT requirements of the CPC Plus program. But if you are in an ACO, one of the requirements of the Shared Savings Program is that you are reporting that. Are the snapshot dates applying for both ACO and CPC Plus practices, and is the 5% bonus for both programs?
The snapshot dates apply for the quality payment program in any advanced APM in the quality payment program. And the 5% bonus is available to any clinician that becomes a qualifying APM participant through any advanced APM in the quality payment program, both of which CPC Plus and SSP Track 2 and 3 are.
Just a note there, the snapshot dates are also used for the purpose of determining whether you get the special scoring under the APM scoring standard if you do not reach QP status or you're a dual participant in the Shared Savings Program Track 1. So your participants will have to be on the Shared Savings Program roster on March 31st or June 30th or August 31st. So for example, I'm in CPC from January 2017 and I decide CPC is not for me and I leave in February 2017. That participant is not going to appear on one of those 3 snapshot dates. Those eligible clinicians, if it's an entire practice, will need to report to the MIPS program as an individual or part of a group in order to avoid a negative payment adjustment in 2019.
Here's a question. Since we have passed the first snapshot date Can we get interim results while we wait for that point D to arrive?
So unfortunately, the answer to that question is no. The earliest QP determination results will be available is sometime after the beginning of August 2017.
Let me see, I'm scrolling through a lot of questions here. If our ACO does not perform well, we will not receive the PBIP. Is that not correct?
No, that's not correct. You would not receive the PBIP in any event if you are a dual participant, because we cannot provide two incentive payments to the same eligible clinicians. So if you're a CPC Plus practice in any of the tracks of the shared savings program, you will report your CPC required measures, just as you normally will. You will be scored on them, but you will not receive the performance-based incentive payment at all. What you will receive and are eligible for, it's not that you will receive it, it depends now on how well you do on the shared savings program requirements and whether you will be getting an incentive from the shared savings that were attained during the performance year.
This is a question that I think gets at the heart of a lot of other questions for practices specifically who are in CPC Plus, either track, and also in a Track 1 Shared Savings Program ACO. This one person is asking, if you are in CPC Plus and a Track 1 ACO, do you have to do improvement activities?
This is Terry Postma from the Shared Savings Program. Once again, if you are if you're in regular CPC Plus or you're a dual participant in CPC Plus and the Shared Savings Program, CMS has already determined that you are going to get full points on that category, on that improvement activities category. So there is no reporting requirement for you at all. You're going to get full credit because you're a CPC Plus participant or because you're participating in an ACO.
Here's a question specifically about the Advanced APM QP bonus. Is the 5% bonus subject to the scaling factor, like the 4% upward adjustment in MIPS?
The answer to that is no. It's simply a 5% incentive payment based off of your Part B billing for the year subsequent to the performance year and prior to the payment year.
Great. I have a question. We have a practice who submitted for CPC Plus but did not get in. Subsequently, they are in MIPS. We do not participate in the Shared Savings Program. Can they qualify for the MIPS APM? The answer is no. If that practice did not get into the CPC Plus program because they didn't meet the eligibility requirements, they will not have practitioners on the CPC Plus practitioner roster, and so they will not qualify for the MIPS APM scoring standard, and they won't be eligible to become QPs in an advanced APM. Question, what is the date of reporting for MIPS for advancing care information? And where is this specific type of information located for review?
Great question for our ACI expert. Elizabeth or Ashley, can you take that for us?
Can you repeat the question?
Yes, the question was about the dates for ACI reporting and where they can go to review that information.
The dates for reporting. So ACI, Advancing Care Information Performance category, you report for 90 days in the calendar year. And so it's any time, you can start any time from January 1st, 2017 through October 2nd, 2017 to get those 90 days in. And we'll have more information on where you actually go to submit your data later on the QPP website.
Thanks. Here's another question. If you are only in CPC Plus, do you still need to submit MIPS?
If you are only in CPC Plus, this is what you're going to do this year. First, you're going to see if you're on a participant list with CPC. If you're unsure, call your help desk. You have to be on that list on one of those 3 dates. If you are on that list, you're eligible to be scored under the APM scoring standard, which really was put into place so that it would reduce duplicative reporting and burden to you. If you are on the list, you will be included in the APM scoring standard for CPC. The only thing that you need to do in 2017 is report the advancing care information category. That is it. You report it as an individual or as a group. CMS will take the highest of the 2 scores that you submit. If you're part of a group and you report it individually, we'll add that to all of the other scores for eligible clinicians in the CPC practice and average it, and you will come out with an ACI score. We'll add that ACI score to the total of 40 points that you're going to receive, which is the maximum number of points for the IA category, and we will have a total composite MIPS score. That MIPS score is then going to be used. So everyone in that practice is going to receive the same exact MIPS score for the 2017 performance period. Alternatively, if you meet the qualifying participant thresholds, you are going to be exempt from reporting to MIPS at all. And the rationale is that you cannot receive 2 payment adjustments. We can't give you a MIPS payment adjustment in 2019. At the same time, we're giving you a 5% bonus in 2019. So you're going to get one or the other.
So we have time for just one more question. Someone asked for a clarification. What are the ECQM reporting requirements for CPC Plus standard practices, not in an ACO, as it relates to QPP/MIPS? And the answer to that is that the ECQM reporting requirements, as it relates to the quality payment program, are just part of CPC. So the only thing you have to worry about are the specific CPC Plus requirements. If you're in a MIPS APM, for the first year, you're good, and after that, we're just going to take your CPC Plus quality score and apply that for the APM scoring standard. And if you're a QP in an advanced APM, you don't need to submit to MIPS anyway. I know that we didn't get to all of your questions. There were over 100. But we will be posting a recording of this and the slides to CPC Plus Connect within the next 2 days, so we encourage you to go and ask questions there. If we could go to the next slide, please. You'll see that there's a great resource for more information, qpp.cms.gov. There's also a phone number you can call, 866-288-8292, or you can email qppcms.hhs.gov. At hhs.gov, sorry, qpp@cms.hhs.gov. Sorry about that, but thank you all for joining us today. We're happy to answer questions as they come up on CPC Plus Connect, and have a great rest of your day. Thank you.
Again, thank you all for joining us today. This concludes our program, and you may now disconnect.